Welcome to Delaware Healthcare Reality, a podcast presentation of the Medical Society of Delaware with Dr. Nicholas Biasotto. Dr. Biasotto is board certified in family medicine, and he has extensive experience and training in treating patients with addiction and substance abuse. Now, let's join Dr. Nick Biasotto for Delaware Healthcare Reality.
Hi, I'm Dr. Nick Biasotto, host of the podcast, Medical Society of Delaware, Healthcare Reality. I'd like to do a little bit of housekeeping and tell you how many platforms we have that you can access these podcasts. And they are Apple, Spotify, YouTube, Amazon, TuneIn, Alexa, iHeartRadio, Player FM, Samsung, and Podchaser. Now also on SiriusXM, Pandora, and Podbean. I particularly like to follow it on Podbean under Delaware Healthcare Reality. Please send any questions, comments, or ideas for future podcasts to healthcare.reality@medsocdel. That's medsocdel.org. healthcarereality@medsocdel.org. My guest today is Dr. Michael Katz. He's running for the U.S. Senate as an independent. Dr. Katz received his B.S. degree in economics in 1984 from Bates College. He received an M.S. degree in physiology from Georgetown University in 1985. He received a medical degree from Georgetown School of Medicine in 1989, and he received an MBA from GU McDonough School of Business in 2000. Dr. Katz completed his residency as the chief resident in anesthesiology at Maine Medical Center and was fellowship trained at Boston Children's Hospital / Harvard Medical School in pediatric critical care anesthesia and was recruited from Boston Children's Hospital to AI DuPont Hospital for Children in 1996. He was the Delaware State Senator from the 4th District from 2008 to 2012. He's a diplomat at the National Board of Medical Examiners and the American Board of Anesthesiology. And he has successfully shepherded a bill to overhaul the DIN, D-H-I-N, which is Delaware Health Information Network, into a statewide searchable database of patients' medical records. And this has been a wonderful thing. Welcome, Dr. Katz.
Good afternoon, Dr. Biasotto. It's good to see you.
Good. All right. First, I'd like to know what changed your course from a business education to a medical one.
Well, I actually always had an interest in going into medicine and healthcare and helping people, but I also had an interest in business as well. Grew up in a small business family. My dad had a cleaning company growing up. He wasn't college educated, and he was also a police officer in our town. So I always had exposure to small business and had an interest in business since I was young. And then when I went to college, I knew that I was going to go into healthcare, but I wanted to understand sort of the background of economics and actually how economics impacted delivery of healthcare and access to healthcare.
Very good, very good. Now I know. Now, as you know, we live in a hard economic times. The cost of living has risen. We have a substantial debt, and we suffer the pangs of inflation. What is your feelings on this issue, tying in the controversial fossil fuel harvesting and utilization of our own resources as opposed to outsourcing?
Yeah, well, I think there are a couple issues, and they're interconnected. The first one is just our overall economy dealing with inflation, national debt, and one of the impacts or influencers of inflation and increased costs of doing business is the high cost of energy. With respect to inflation, economy, there are things that we need to do to incentivize business growth. We need to do things that are able to drive down the cost of doing business, because a high cost of business will ultimately lead to increased costs in the grocery stores and in the stores and ultimately in all household goods that we acquire. So I have several different policy things that I'd be looking to do to help make things more affordable. and to drive inflation down. I believe that one thing we need to do, especially in healthcare, you see this, we have a shortage of workforce, and cost of goods really comes down to labor and materials. So we need to invest in education, workforce development, introduce tax reform policies that spur economic growth and reduce corporate tax burdens, and provide incentives for business investment. We also need to simplify the tax code to ensure simplicity, fairness, and competitiveness. And one of the issues that you spoke about was cost of energy. We need to be energy independent, which will significantly lower the cost of doing business, and it's also a national security issue. Other things that we can do to drop ultimately the tax burdens, improve government efficiencies, is to improve operational efficiencies of government and consolidate services in government. That's a whole other plan that I have in order to decrease the size of government and improve efficiencies and operational costs. And finally, we need to be fiscally responsible as a government, passing balanced budgets and implementing a plan to pay down America's national debt. I actually believe that the national debt is one of the most serious issues that we face at the national level, and that we're essentially bankrupting the country and spending a significant amount of our GDP in focusing on paying down debt.
Solid ideas, Doc. Okay, let's go on to health care. Our interest here at the Medical Society of Delaware. As a physician, you realize that the practice of medicine is a broken system. Doctors are retiring early than usual. Some are seeking new vocations outside of medicine, and now our primary care docs are beginning to become few and far between. Is there a solution to this problem? Can we save the foundation of medical care, i.e. the primary care physicians? Is the answer a one-party payer system?
Well, the bottom line is healthcare in America is broken. As a pediatric critical care anesthesiologist and with over 40 years of experience working in the U.S. healthcare industry, I know more than career politicians and corporate interests, and just like physicians and nurses in hospitals, they understand what it takes to care for patients. America's health system is very expensive, but it's very good at treating the sickest patients, but it fails to improve the overall health of America. And we really need to look at a paradigm shift from treating illness to preventing it by changing behaviors, lifestyles, and focusing on community and public health. So as a anesthesiologist and a pediatric focus, I know that really the important areas to focus on are making sure that we have healthy pregnancies, healthy babies, and we need to make sure that we have the nutrition available for the kids so that they are starting off their life well. There are three pillars that are all very interconnected. So when we talk about healthcare is also connected with the first issue we talked about, which is economy, jobs, cost of living, and it's also interconnected with education. So we focus on healthy babies, healthy pregnancies, and then we also need to focus on early childhood education, making sure that we are offering kids, within the first weeks and months that they have access to early child appropriate education everywhere, regardless of zip code and economic capabilities. This also will allow kids to ultimately pursue their passions and their dreams in their life. So we have healthy babies, they have good access to healthy food, good education, and ultimately leads to economic prosperity, hopefully.
Earlier podcast it was mentioned that it's the American way, it's the way we live our lives that is driving the cost of medicine up in this country. Chronic diseases, COPD, obesity, diabetes, etc. It's the way we live. So your ideas of going from a treat it to a prevent it is a great idea. And I think that if we could get more education out to the public on how to stay healthy and get them to do it, I think we'll save a lot of money when it comes to health care. Previous podcasts that we have done have shown that the cost of care and medical care in this country is due to much of the behaviors of our individuals, with them not eating properly or drinking too much or doing drugs, etc. So your idea of prevention and wellness as opposed to treating just the disease is an excellent one. And if we could get to that point, I think we could save a lot of money. Now, we have some of the best educational opportunities compared to many other developed countries here in the United States, yet we fare poorly in academics. Many high school graduates cannot read or write at level and are not capable of simple math. Why do you feel this has occurred, and what do you recommend to remedy this problem? Should our tax money go to public education only, or can people choose to use this allotment for private schools if they wish, as private schools seem to do better when it comes to these areas of education?
Well, I think one of the things you're referring to is school choice and vouchers, and I believe that that's more of a indication of a downstream problem with a broken education system. It's a symptom we're treating and not solving the upstream problem, and which is a broken education system. And it's not only in Delaware. We have problems in Delaware as well. We are one of the highest expenditures paid towards education in the country, with one of the lowest in the country with respect to performance. So it's not necessarily a money issue. It's the structure of education and how our education is delivered. And it's not only in Delaware, it's nationally. So I believe that we need to restructure how and rethink how education's performed, get back to the basics, making sure that every child has the ability to do reading, writing, and arithmetic. But also there are other issues that we need to look at as far as which relate to health care. Making sure that we're having healthy children, that they have access to good food, that we're looking at their home environments as well. They're in school for maybe 6+ hours a day, but you don't necessarily know what a child is dealing with in their home that can impact their ability to perform in school. So it's a lot of interconnected issues. It deals with economics. It deals with health care as well. So. Basically, it gets to making sure we have healthy babies, healthy pregnancies, and starting that school and education in early childhood, in the very early, weeks, months of the child's life. And that way we can sort of rebuild the foundation of education and move forward.
Good ideas. I know that you're a big proponent of our veterans and first responders. It is sad that many of our vets are homeless and living on the streets. Many have been severely injured in battle, defending our nation. Many vets and first responders have died in service to our country and its needs. Yet we seem to want to give support to immigrants who haven't come into this country legally, that have come and have had many of the benefits that we should probably be giving to our veterans and first responders who have been injured. Do you support this platform? In other words, help our veterans as opposed to those who haven't even been in our country a year? If you don't support this, is there a way to give our brave soldiers and first responders their due?
Yeah, I think I'm going to divide the question here. You've got a couple questions, one dealing with vets and first responders, and the other's immigration issue. First of all, the veterans and first responders are, the veterans they're the guardians of our nation. They provide they are true servant leaders. They step up to serve their country. They put their lives at risk, and it's not only the individual that's serving in the military that is serving, it's the entire family that is serving. So we owe all our veterans and those currently serving our country a great deal of gratitude, and we owe it to them to the respect and the resources they need, not only while they're serving to make sure that they are able to live comfortably, healthy, and safely, but also to make sure that we're taking care of their families while they're serving, and also the veterans when they do leave service, because we are able to live our life of liberty and justice and equality for all due to what the protections that the vets provide, and making sure that they are providing the protections of our values, our constitutional values. Same with the first responders, the police, fire, and ambulance, EMTs. They serve every single day. They are overworked, underpaid, and understaffed. They go to work every day. They wake up. They take the call to duty, and oftentimes put their lives at risk. So our society and our country needs to make sure that we take care of the vets and first responders not only while they're serving but after they leave service as well, and make sure that their families have the resources that they need. With respect to immigration is the foundation of our country, of America. Most Americans are descendants of or are immigrants themselves. Immigration can make our country stronger and better. And our country's been built by immigrants, but we need to have legal, safe, and secure immigration. We're a country of laws. We need to maintain law and order and fairness, and it's also a national issue, making sure that we have secure borders. One of the first things that I was concerned about when the big surge of illegal immigration coming across the border was, as a physician, thinking about the health implications. What are the diseases that are coming across the border that we've already eradicated in this country? What are we exposing our communities to? So we should not tolerate illegal immigration. We should not be incentivizing it. And it's a very quick fix to secure our borders. We do have the capabilities as a country. But the foundation of America is immigration, and I think we should have legal, safe, and secure immigration and borders.
Great. I think the government must step up to the plate on this issue and do something good. We have outside organizations such as Tunnel to Towers that is providing housing as well as financial help for individuals of veterans who have suffered injuries and first responders. A great organization, and I think the government can help out in doing its part in that area. Will the younger generations be able to achieve the American dream of owning a home and raising a family? That's a good question. The family remains the cornerstone for a thriving economy and country. At present, the American dream seems to be a pipe dream. Can we remedy this problem with good, sound economic changes?
Yeah, so the American dream, it gets back to the economic issues, making sure that we have economic prosperity, making sure that and opportunity. The American dream is opportunity, equal opportunity for all, and the important part of the important foundation needs for that are making sure people have a good education, that they're healthy. But one of the biggest issues right now is affordable housing. I know many people that I speak with throughout Delaware, especially younger families, are they ever going to be able to afford a house, especially with the interest rates so high and also the stock of housing low. It's driven the cost of housing up very high. And also with inflation, people have less disposable income or income that they can use to save for a house because the cost of goods and services and going to the grocery store and gas is so expensive. I do believe that with the right leadership, that we will be able to restore the American dream, and what that requires is making sure that we have a strong, robust economy, that we have energy independence to drive down the cost of business and ultimately the cost of goods and services, and strengthening our education system so that we're training the workforce of the future.
Very good, thank you. We'll be right back after a short break. You're listening to our podcast, Delaware Healthcare Reality, with our guest, Dr. Michael Katz. Back in a minute.
Information about the Medical Society of Delaware can be found on our website, medicalsocietyofdelaware.org. Questions about our podcast can be emailed to healthcare.reality@medsocdel.org. That's medsocdel.org. Once again, here's Dr. Nick Biasotto.
We're back from our break with Dr. Michael Katz as our guest today. Dr. Michael Katz is an independent candidate for the U.S. Senate from Delaware. Dr. Katz, it is said by some that a strong military defense is the greatest deterrent to war. In your opinion, how so? And do you propose more military spending to accomplish peace?
Well, first of all, I agree the fact that America needs to have a strong military. It needs to be effective and lethal, but it ultimately we want to maintain a strong military to hopefully be a deterrent to any conflicts or to any attack on our homeland security. So Homeland Security is critical with respect to national defense, and also making sure that we are able to defend our interest internationally.
Back to immigration, which is the hot topic. It's estimated that the southern border has been wide open, as you mentioned earlier, to the onslaught of some 10,000 immigrants who have not entered through the legal process, one that we really have, and that many of them pose a threat to our nation. Is there, in your mind, a solution to the problem of illegal immigration? And those that have come here already are in our country, should they stay? Should they be given amnesty? Or should they be deported? What is your opinion on this?
Complex issue. First of all, we need to stop the bleeding. We need to stop the illegal immigration. We need to bring in the people that understand border control, the experts in our government that are actually on the line every day on the borders. We need to say, what do you need to make sure that we have a secure and safe border? And quite frankly, I believe in zero tolerance for any illegal activity, including illegal crossing of the border. So the first thing is to make sure that we secure the border. Then two, we need to find the people that are here illegally. And quite frankly, I think they broke the law. The first act in coming across into this country was to break the law. I believe that they should be returned to where they, to their homeland or to their country of choice. If there are people that are seeking legitimate asylum here, we need to treat them with respect and care. And even the people that we do ask, remove from the country that are here illegally, we need to treat them with respect. I mean, the foundational principles that I follow, we need to respect our common humanity, be respectful of each other, work for and seek unity, and work together with everybody in this, in America to solve problems and solutions, but also internationally we need to follow that code of conduct. So while we may be deporting people, we need to treat them respectfully and make sure that we treat them with care, especially the kids.
Thank you. Thank you very much. I want to get on the subject of prior authorizations. As you know, that's a bugaboo of mine. I've been dealing with it for many years. We have doctors who do not like the system. It's contributing to physician burnout. We have patients who may be suffering for not getting their medications or their testing on time, so we're jeopardizing patients in that area. The issue does not seem to have come up in Congress at this point in time. I'm wondering if in the Senate you can make an issue of this in helping our physicians and patients in the United States.
Yeah, well, there's a short-term and a long-term solution to this. The short-term is that, first of all, as I said earlier, we have a broken healthcare system. So there are significant changes to the healthcare system that I'm going to pursue in the U.S. Senate and working with people throughout the Senate and Congress to accomplish those goals. But on the short term, we need to, what you bring up about pre-authorizations, that's access to patient care. Nothing should come in the way of people accessing the care that they need to either treat a disease or to make sure that they maintain their health. And so I see prior authorizations as conflicting with access to care and preventing people to access to care. So that needs to be done away with. We need to trust the experts who have the expertise to care for patients. And, so we need to let physicians and nurses and other people throughout the healthcare system do what they are trained to do to care for the patients. With respect to the healthcare system overall, the prior auths and problems with Medicare, which is also a broken system, these are all downstream symptoms of an overall broken healthcare system. So I believe that we need to, as I said earlier, redesign the healthcare system, focusing on population and community health, making sure that we're leading healthy lives, but also the health system needs to be redesigned so that we have completely integrated national health systems, not one health system, but health systems that leverage public facilities, private facilities, for-profit, not-for-profit, and academic facilities, so that we're a health system. And the health systems will be able to provide the care and the efficiencies not only within the urban centers but in small rural hospitals.
Good. Tying into this physician burnout issue, Congress continually attempts to reduce doctor reimbursement. Presently, I think we're up for a 2.8% reduction. I'm not sure of the number there. What's your stance on that issue? And I don't think doctors have seen much of a raise, not even comparable to keeping up with inflation. So it's not fair to the physicians, and many of them are burning out, and some of them can't afford to stay in practice. What do you say?
Well, physicians are some of the hardest, most dedicated people in our communities. While they actually have had cuts in their pay when you factor in inflation, cost of maintaining an office, all the unreimbursed or unpaid mandates that are put on them year after year by state and federal governments. It gets back to just a completely broken healthcare system. So physicians and nurses and other technicians throughout the health system need relief. We have shortages of, it comes down to labor and materials. We have shortages of labor. We need to make sure that we are training the medical professionals to meet the needs of our community, and people are just working double overtime to care for their patients because they're so committed.
It'd be nice to have you there to take care of some of these issues, I think.
Yeah.
Lastly, Dr. Katz has an opinion on Delaware Online dated June 14, 2024 regarding the unique position held by an independent senatorial candidate to bridge the divide in our present two-party system. It's a good read, and you may find it on his website, drmikekatz.com, drmikekatz.com. Well, thank you very much for being here today, Mike. I appreciate you. I hope you have a successful run. I wish you your best, and thanks a lot.
Thank you so much. I appreciate it, and thank you to you and all the leadership that you've shown for the medical community and for the medical side of Delaware and all the physicians around the state, and for the hard work that you do. And on behalf of our entire community, I thank you.
Thank you.
This has been Delaware Healthcare Reality, a podcast presentation of the Medical Society of Delaware. For more information about MSD, visit our website, medicalsocietyofdelaware.org. For questions or suggestions regarding our podcast, email us at healthcare.reality@medsocdel.org. Thanks to audionautics.com for our music. Delaware Healthcare Reality is produced by Tom Mitton. I'm Lori Ann Rhodes. Watch for our next podcast episode. Until then, be well. The Medical Society of Delaware, MSD, is providing this podcast for informational purposes only. It provides neither medical, legal, nor any other professional advice. The views, thoughts, and opinions expressed by the hosts or any guests are their own and do not reflect the views or policies of MSD. Unless specifically stated, reference to any specific product, service, or entity does not constitute an endorsement or recommendation by MSD. Reliance on the information provided in this podcast is exclusively at the risk of the listener. MSD expressly disclaims any and all liability or responsibility for any direct, indirect, incidental, or other damages arising out of any individual's use of, reference to, or reliance on this podcast or the information presented in this podcast.